Infertility is an issue many would rather not be faced with. It's even a topic they would rather not discuss, possibly because of how society views people who cannot or who haven't been able to conceive.
Mtoto ndio kesi ya kesho. Hiyo ndo sasa hiyo ndo ukiwa na mtoto ndio hata wewe unafurahi.
We have social negativity. People will be looking down on to you, thinking that this one
inaweza cause separation, inaweza fanya ukuwe desperate huku utakikani.
In society, children are considered to be something very good in a marriage.
Many women consider that without children their lives are without hope. It is either motherhood or nothing. Society does not make it any easier, especially considering what many think to be the cause.
Shida utokea kiusazi ya mwanamke.
We have these birth control pills.
Infertility inakosiwa na tuseme mtu akitumia hizi perfumes zenye siku hizi tunatumia, kind of food zenye tunakula.
It could be hereditary. It could be spiritual.
But what exactly is infertility?
A couple has been living together and having sexual contact for at least 1 year and without conception. That's what we call infertility.
Infertility can affect either man or woman. The causes therefore can be from either of the two. In men, this could be congenital, sexually transmitted diseases affecting the reproductive system, trauma or injury, viral infections like mumps, hormonal imbalances or certain work environments that expose men to high temperatures.
Female infertility, the causes are also diverse. Congenital causes, or where the ovary is not well formed. Commonest cause of infertility in the females is what we call pelvic inflammatory disease, which is in majority of the cases sexually transmitted.
According to the World Health Organization, more than 30% of women between the ages of 25 to 49 in sub-Saharan Africa suffer from secondary infertility. This is a failure to conceive after an initial first pregnancy. Despite male infertility causing 50% of couples' failure to conceive, the social burden often falls on the woman.
Women are always the easier option, or the easier target to say the woman has a problem with fertility. That's where we miss the point, because that inhibits the men from coming forward for treatment.
With an issue this complex, what solutions do we know?
Kuna dawa ya kienyeji ambapo unatumia. Najua siku hizi hawataki kutumia hiyo dawa ya kienyeji.
Visiting gynecologists. Nowadays we have these herbal medications, yeah?
Medical solutions, if it is a medical problem. If it's a spiritual problem, I think there are also spiritual solutions.
While some of these may work, the solutions to issues of infertility are as diverse as the causes. They demand time and patience. Some are simple, while some are complex, causing a definite financial strain.
Cost implications is sometimes enormous, depending on the degree of infertility. If, for example, we have a male who is having just a reduced number of sperms, but they are present. We call that oligospermia. The cost of treating that cannot be compared with somebody who has no sperm at all.
Almost all cultures in Africa demand that a woman to be socially accepted, she must have at least one biological child. This skewed view of infertility piles pressure on a woman who may have nothing to do with the childlessness. Dr. Mercy Korir for Health Digest, KTN News.